The way I discuss with my patients about why this occurs is, if you imagine yourself in a very warm, hot room as a student in a lecture, and you just had a very big, heavy lunch, perhaps with some alcohol in it, the tendency for you would be to feel very drowsy and sleepy. And this is a very mild form of postprandial, if you like, drowsiness. Now, postprandial syncope is an extreme example of that, and really what it is that the body has the ability to adapt, or the body should really adapt to changes in physiology. That is to say, after a big meal, there is the necessary re-shunting or redistribution of blood to the gut and the splanchnic system to take away the nutrients that are being digested in the stomach. And as a result, the shunting of blood going to the stomach, there may be less blood going up into the brain, and so patients feel drowsy. So in the extreme example, again, with the sitting ducks all in a row, with dehydration, a hot environment, maybe possibly a bit of tiredness, a bit of alcohol, perhaps causing some vasodilatation, again, shunting the blood away from the central system and the brain into the vessels, into the legs, and shunting of blood into the stomach. This is what can lead to a situation where there's not enough blood pressure to the brain, causing syncope. Treatment for postprandial syncope is a recognition that you are a patient prone to having this condition, and therefore take the appropriate evasive action after a large meal. For example, not sitting in a warm, crowded environment, making sure you're adequately hydrated, perhaps avoiding alcohol in that situation, and the conservative things such as performing isometric counter-pressure exercises. These are very simple exercises such as clenching your hands together and pulling apart, gritting your teeth, and really flexing and tensing the muscles of your calves and your quads and your buttocks, the large muscle groups, to act as a pump to squeeze the venous blood back into the central circulation to get the blood flowing to your brain again.